So let's talk about the immune defenses and the difference between each one of them. Now, let's start with primary defense. These are your soldiers, all right? This is your first line of defense. Let's break it down. So normal flora, our body has normal flora, and any treatment that disturbs this balance of our normal flora can increase our risk of developing an infection. Our skin is imperative to be intact, all right? This prevents the entry. So if we go back to the chain of infection, this prevents the entry of any infection or pathogen, I should say, from entering. Our respiratory is pretty awesome. So remember in anatomy, you guys talked about like the respiratory tree, the nares, the trachea, the bronchi, and how there's tiny hair-like cells that help capture pathogens. And with coughing and sneezing, it pushes this out. Those are called cilia. The tiny hair-like cells, those are cilia. And so eyes as well, they have the lacrimal glands, so they produce the tears. And then your mouth has saliva. So let's do a little example. I mean, if this has never happened to you in your life, that's awesome. But I bet that this has happened once or twice. You're walking in the park, you're talking, you're laughing, and all of a sudden you go, you just got a bug in your mouth, right? You just walked into just a nest of little gnats. Now, that just went into your respiratory tree. Automatically, your cilia is going to capture that little bug, that pathogen, and it's going to make you cough or sneeze, and you're going to push it out. Same thing with the mouth. Now it's in your mouth, and that saliva is going to capture it, and you're going to spit it out. Now your eyes, you probably have had a bug in your eye. Same thing. The tears that are produced, they capture that bug, and then you kind of wash it out, or you can pull it out. Your GI tract. Your GI tract is very acidic. Most pathogens are destroyed within your GI tract. Same thing with your the vagina as well. It's very acidic, and the normal flora help keep the pathogens in check. Now let's go on to your secondary defense. Now our secondary defense helps along with the primary defense. And we start with the pathogens, or the phagocytes, sorry. Phagocytes. The phagocytes are what type of blood cell? They're your white blood cells, yeah. They help engulf those pathogens and they destroy them directly. So I think of them as little soldiers as well, because I can just imagine them just going over marching and then with their swords and they destroy the pathogen. Now then we have the complement cascade. So this is a set of blood products called complement. It triggers the release of chemicals that attack those cell membranes of the pathogens, and they actually make them rupture. It's pretty cool. So that's what it means by the cascade. Then inflammation. So if there's an infection, you're going to have the natural response of inflammation. When there's inflammation, it causes more blood flow to that area. Now, when there's more blood flow, what is it going to appear like? You're inspecting that site. Okay, let's say the patient says their right lower leg hurts, and then you notice it's red and inflamed. Yeah, that's inflammation. So it has erythema, which is redness, and it's inflamed. Now, what's another response that that body will have? A fever. A fever is going to get triggered. So it increases metabolism and it inhibits the multiplication of the pathogens. So then we go to the tertiary defense. So there's 4 different kinds for the immunity. There's a artificial, and then there's the natural. So we have the natural active immunity. So this is your body starts developing their own antibodies. For example, you just have a cold, and your body automatically starts developing those antibodies and help try and fight it. Then you have the natural passive immunity. So the passive active immunity should say natural passive immunity. So I'm going to cross that off. It should say natural passive immunity. Okay, so this is like the natural antibodies passing from one body to another, so such as breast milk or the placenta. Then you have your artificial active immunity. Okay, so this is when the body is exposed to weakened or dead pathogens in a vaccine. These are immunizations. Then you have your artificial passive immunity. So protection from an infection is achieved when from one serum, okay, from another person has already been produced antibodies against that pathogen. So your book gives a great example, so such as rabies. Rabies is a great example for artificial passive immunity. So let's talk about the stages of infection. So the first stage is incubation. So this is the period when the pathogen enters into the host and the presentation of the symptoms begin. The person doesn't really know that they're infected yet, but during this time, they can infect others. Usually it only lasts about a day, such as the influenza, but if it's like tuberculosis, it could be months to years, okay? Then the next phase is prodromal stage. So the prodrome stage is the first appearance of vague symptoms at the onset of illness. So if a person has a cold, they may experience that mild throat irritation. They just go, oh, I just have a little cold. All right. So this could last just a couple of days as well. The illness stage. So this is when the patient becomes ill, when the first signs and symptoms of the disease occurs. So the patient's immune defenses and medical treatments, if any, are ineffective. Now, if they are unsuccessful, patients can die in this stage. So let's go back to what we talked about in the chain of infection. Who is at a high risk for death in an infection? What about those? Remember the host? Yeah, patients who have immunocompromised, very young or very old patients. All these patients, they lack that immune defense sometimes, and sometimes it doesn't work as well. And the medical treatments, sometimes they just don't work as well either. And they can get, let's say they had a cold, and then that cold had turned into pneumonia. All right. So now they just went from a primary infection to a secondary infection, which we'll talk about in just a few moments. So let's say this patient was able to beat this cold, and they didn't die in the illness stage. Now they're going to decline, the decline stage of infection. So their immune defense successfully reduced the number of pathogens, and the infection begins to decline. Then you have the convalescent stage. So acute symptoms start to disappear. Pathogens continue to reduce until none are left, resulting in full recovery. So this could be a day or two as well. But if there's a severe infection, it could be up to a year, depending on the client. So classification of infection. So location. So a local occurs in a region of the body, such as if they have a urinary tract infection, it's going to be in the bladder. If they have an ear infection, it's going to be in that right or that left ear. Also, so if they have a bone infection or upper respiratory infection, it's going to be in those locations. A systemic infection spreads through the blood or the lymph nodes. This is a multiple systems affected. Septicemia is a symptomatic systemic infections spread through the blood. People die from being septic. Then there's bacteremia. Bacteremia is bacteria in the blood. Patients die from this. Now, how can you prevent this from occurring? Washing your hands. Yes, washing your hands, covering your mouth when you cough, making sure that you are not sharing gloves between two patients. Okay, so now let's go to the primary infection. We were just talking about this, about how if a patient has a cold, that is their primary infection. It's the first infection that occurs. Then let's say they get pneumonia. That's the secondary infection. It's one or more infections that may follow a primary infection. So example is pneumonia caused by bacteria after having upper respiratory infection, like a cold or an ear infection, that was caused by a virus. So patients can come in and have one infection, but after a certain amount of time, they can get that secondary infection. So response to local injury or infection. What is the normal response? The first stage is going to have that erythema, the redness, warmth, edema, pain and tenderness, possibly the loss of use of that body part. Second stage, the microorganisms are killed. Exudate appears. So exudate, we're going to talk a little bit more about this in class, but in the meantime, I would look this up, is you might see dead tissue cells. It may have white blood cells, that purulent drainage. So exudate is drainage from that site. Third stage, the damaged tissue is replaced by scar tissue. So let's take a look at this. So what does this look like? Looks like they have a wound right here, has some erythema, some swelling, it's probably painful, and they have some drainage right there. Right there they have drainage. So infections by duration. So acute is a rapid onset and a short duration, such as a common cold, chronic, slow development, and long duration, so such as osteomyelitis, so it's a bone infection. Latent infection with no discernible symptoms, so such as HIV or AIDS. What do you think this is? What is that? Looks pretty bad. Now, initially, I'd like you to describe that. How would you describe this? You're going to document your findings, okay, your objective data. I would like you to document your findings. Okay, so now I'd like you to write some questions about what would you ask this patient? What are some questions you would ask to collect more subjective data? All right, so here's a question. I'm going to let you read this. You can pause the video and read it. We're going to keep going. So risk factors. These are all risk factors for infections. Inadequate hand hygiene, chronic diseases. What are some chronic diseases or just factors that could cause a host to be more susceptible for an infection? It could be their developmental stage. Younger children are more vulnerable because their immune systems are immature. Older adults, because their immune systems decline with aging. Their skin, the primary defense, becomes less elastic and more prone to breakdown. Also, elders, the elderly are less active and their nutrition is very poor. How about any type of break in the first line of defense? Tobacco use. Tobacco use is huge. Smoking affects their immune system. Substance abuse, huge. Multiple sex partners, that's a big one. Environmental factors, such as if they work as a kindergarten teacher or healthcare worker or a nursing home, they're in those small spaces, crowded environments. They can cause a high risk of infection. Chronic diseases, so HIV, medications can cause, it can be a big risk factor. They can inhibit the immune response. Nursing or medical procedures, so surgical clients who have lines, drains, or tubes, patients who have stress, drug use, IV, shared needles. These are all big risk factors for being an increased risk for infection control. So older adults, what are their risk factors? Like we just talked about, they have a slowed immune response, they're thinning of the skin, they have a decreased elasticity in their skin, slow wound healing, their appetite's very poor. Sometimes not sometimes, but their taste buds really want those sweet treats. So their nutrition is not the best. Decreased cough ability, chronic illnesses, their mobility has decreased. They may have incontinence, may have dementia, and they could have a catheter. A catheter is a huge infection risk. So expected findings within labs. So first, your assessment. You're going to assess if they have a fever, chills, do they have an increased heart rate? How about their respiratory rate? Is it increased? Malaise, fatigue, anorexia, nausea, vomiting, diarrhea. Do they have any abdominal cramping? How's their lymph nodes? Are they enlarged? Older adult considerations, are they agitated? Confusion, incontinence. Older adults, if they have a urinary tract infection, most commonly you will see confusion, agitation, incontinence. That infection, especially in older adults, will cause these symptoms. Their labs. So the labs, they'll have an increased white blood cell count, so greater than 10,000. Their specific white blood cells, neutrophils, elevated ESR, so it'll be greater than 20 millimeters per hour. So these are all indication of inflammation. So the culture present for specific microorganisms. But initially you will see their white blood cells to be increased. That is a huge red flag that possibly they have an infection. So let's think about some nursing interventions. What are some nursing interventions we can do? How can nursing break the chain of infection? Effective hand washing. Educate clients on immunizations, especially those at a high risk. So smokers, older adults, get the pneumonia vaccine, get the influenza vaccine. Educate clients on good oral hygiene. Adequate hydration for the skin and their GU system. Immobile clients, pulmonary hygiene. Okay, change positions every hour. Do the incentive spirometer every hour. Repositioning. Oral care, cough etiquette, education on stress relief and adequate sleep. These are all huge things that we can do as nurses. So clients who had surgery, okay, they're at risk for pneumonia. Promoting deep cough or deep breathing and coughing will really help them decrease their risk for pneumonia. Clients who are ventilated, okay, mechanically ventilated, doing frequent oral care will help decrease that risk of pneumonia. Clients who have poor nutrition, educating them on nutrition and including proteins, vitamins, minerals, and their water intake. Hygiene is huge. Educating the clients on personal hygiene. Taking a shower. Why is this so important? If a person doesn't take a shower and in their genitals, they're keeping all that bacteria down there and they can multiply, their skin is going to get irritated. They could develop a rash, which could develop into an opening. So that's just a portal of entry for pathogens. Another intervention that we could do as nursing interventions is cleaning your hands frequently and maintaining a clean environment. So when you see something that has a visible soiled or is visibly soiled, clean it. If it needs to get bleached, bleach it, disinfect it. Items that need to get sterilized, sterilize them. There are some infections that you have to use bleach. So know what type of infections you can use bleach for, or just normal cavi wipes. So again, balance hygiene, clean equipment between patient use, clean up dirty surfaces immediately. Urine on the floor, use a disinfectant. Client's items from room, home contaminated. Reheating food from the client's room. Once that food goes into the client's room, it stays in the client's room. It doesn't come out, it stays in there. Because we don't want to cross-contaminate throughout the whole department from the microwave. All right, so here's a question. Which of the following actions violates a principle that is key to proper hand washing at the bedside? Which of the following actions violates a principle that is key to proper hand washing at the bedside? Washing your hands for 1 minute, shaking your hands dry over the sink, using warm, not very hot water, using the soap provided by the agency. What do you think? I'm going to let you look at it. Okay, here's another question. I'm going to let you guys do these questions, and then the rationales and the answers are in the notes. Here's another question. This is a select all that apply. Another question. So here's a little recap. Chain of infection. You have the causative agent, toxins, bacteria. Then you have the reservoir. It could be human, animal, soil. The portal of exit, how does that bacteria, the pathogen, get out? Could be from the blood, respiratory tract, could be from urine. Mode of transmission, so how does it get out? Is it because it was a direct contact? Or was it an indirect contact? So let's say I went to the bathroom, didn't wash my hands, that's an indirect contact. Was it from coughing? Or was it from a sneeze? Then I have to think about, okay, that portal of exit. Let's go back to that picture we saw. We saw that guy sneezing. Portal of exit was respiratory tract. All right. So mode of transmission, it was droplet. Let's say no one was around and I just came on my shift and I didn't clean off my keyboard. All right. And he was a nurse. He's a nurse that I work with. So I got a report from him, didn't clean off my keyboard. He sneezed on his keyboard. All right. So that is now contact and droplet. So I'm touching the keyboard. All right. I'm getting all of that good causative agent, that bacteria. So then I have an itch in my eye. All right, you know what? I feel like there's a popcorn in my mouth. So I try and go and get it. Portal of entry. I've now just taken that bacteria that he sneezed out and it fell on the keyboard, and then I touched it, but then I felt something in my mouth, so then I put it in my mouth, and that's the portal of entry. Now we have to think, okay, am I a susceptible host? Like, am I an older client? Am I a younger client? Do I have a renal transplant, or am I a transplant in general? Am I immunocompromised? No, I'm not. But then, we'll talk about the risk factors in a minute. But then I have to think, okay, my defenses. I'm going to think about my defenses. Initially, my primary defense is going to go up. Okay, so hopefully that hopefully help you understand the chain of infection. So now let's get to the risk factors, like we just talked about. Compromised immunity. If they have chronic or acute diseases, poor personal hygiene, crowded living environments, IV drug use, unprotected sex, poor sanitation, then the virulence, so the ability of the pathogen to produce the disease. So to recap from the types of immunity, so we have the active natural immunity. So this is where our body produces the antibodies to respond to the exposure of the live pathogens. So such as like a common cold, we have those antibodies. The active artificial immunity, so this is the response to the vaccines. Okay, our body produces antibodies in response to vaccines. Passive natural immunity, so this could be from mom to baby, passing through the placenta or the breast milk. passive artificial immunities. So this is when immunoglobulins are administered after the patient has been exposed to a pathogen. Non-specific innate immunity. We didn't really talk too much about this, but I'd like you guys to read about this. You can find more in your book. Then the stages of infection. So incubation, again, time from when the pathogen enters the body until the first symptom appears. They can make other people sick during this phase because they don't think they're sick. The prodromal stage, this is the time of the onset of the general symptoms, the fatigueness. Illness stage, so this is when the specific symptoms occur. Convalescence, this is when the symptoms start to disappear to complete. All right, systemic infection. So systemic infection, so it could be bacteria in their blood, so bacteremia, or it could be septemia. So they're septic. Okay, so this is overall. So symptoms can include fever, chills, fatigue, malaise, increased heart rate, increased respiratory rate. So the body's trying to compromise with and try to fight off this infection. Local infections, so that one particular body part could be edematous, painful, erythema meaning redness, and it could be warm. What lab tests could indicate infection as well? You have your white blood cell count. You have your immature white blood cell count, so the left shift. The ESR. So ESR is a non-specific measure of inflammation. It stands for erythrocyte sedimentation rate. You have your CRP, so it's a C-reactive protein. Again, this will rise when it's response to inflammation. Positive culture results. So you will get blood cultures when someone has an infection, if you need to. Now, before you even start those antibiotics, you must get blood cultures. Inflammation, so the body's local response to the injury or infection. The first stage, okay, it's going to look like erythema, warmth, red, pain at the site. Second stage, the white blood cells kill the microorganisms. They'll start having exudate. The third stage, so those damaged tissues are replaced by the scar tissue. So practices to prevent the spread of microorganisms. So cover your mouth or nose when sneezing or coughing. Is it appropriate to tell a patient or a visitor to cover their mouth or nose when sneezing or coughing? Absolutely. Our job as healthcare providers, we are trying to help protect the population and to educate. Education is key. If they don't know, they don't know. But you won't know that until you tell them. Use tissues, dispose, and wash your hands. Stand at least 3 feet away from those who are coughing or have them wear a mask. Keep your nails short. No artificial nails or gel polish. Remember when we did the hand hygiene in class and I had some people who had gel nails? They just had them replaced, and the green lotion I gave you guys, and with the UV light, it was actually getting stuck around the gel. Perform frequent hand hygiene. Do not shake linens. Why not? Okay, because there might be organisms in there, and now you're just putting them in the air. Clean least soiled area first in the client's room. Please make sure when you go into your client's room, clean the entire area. Now, you don't want to go to the area that is the most soiled, because what's going to happen? You're possibly going to spread that to the entire room. Do not place items on the floor. Okay, so we're going to start learning about bed changes and how to do the bed changes and what to do with the sheets. And it's not appropriate to put dirty sheets on the floor, because now it's going to get on my shoes and attract it to a patient who's immunocompromised. And then they don't wear shoes, right? Clients don't wear shoes. They wear socks, or sometimes they go barefoot because they're like, I just can't do it. I just need to go. All right, please wash your hands. Wash, 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 wash all the time. Don't spread germs. Even when you go home, wash your hands before you go home. So now we're going to talk about sterile field surgical asepsis. So how to set up a sterile field. I'm briefly going to talk about this right now because we are going to talk more about it in class. So actually, you know what? I'm not going to talk about it at all right now because it's better if we talk about it in class. So I'm going to skip the surgical asepsis slide. All right, so standard precautions. We learned about standard precautions the other day when we were doing hand hygiene. So hand hygiene versus soap versus gel. Also, when you suspect any splashing of bodily fluids, you can put a mask, a shield, and gown on. Clean gloves must be worn when touching anything that can be contaminated. And when you have soiled items, put them in a moisture-resistant bag. And when you have sharps, please properly dispose your sharps into the sharps container. So now we're going to get into the good stuff. Well, everything else was good, but we're going to go into more of the transmission-based precautions. So the first one we're going to talk about is contact precautions. So this is a typical sign you will see outside of the class, or not classroom, but outside of the patient's room. So it says stop before entering, wear gloves and a gown. Okay, so contact. Protect those when they are 3 feet of the client against direct client environmental contact infections. What does that mean? That means you need to stay within 3 feet of the client, okay? If you are 3 feet or closer, you must wear a gown and gloves. What type of diseases are there in contact precautions? Impetigo, scabies, MRSA, VRE, RSV, herpes simplex, draining wounds, infectious diarrhea, such as C. diff. C. diff. When you have a client who has C. diff, you must use soap and water to wash your hands. C. diff is it is a very contagious bacteria that's in the GI, and we're going to talk more about this in class tomorrow, but it is so contagious that, let's say a patient has C. diff and they touch their phone and I touched their phone and I gave it to them and I didn't wash my hands, I could get it and I could bring it home with me. So what is required? What's required in the room? It's a private room, or they can be with another client with the same infection. Gloves and gowns are required for caregivers and visitors. So once you enter that room and you're within 3 feet of that client, you must wear a gown and gloves. Transporting. So if they need to go to, say, X-ray or CT, transporting the client, what do they need to be wearing? The client does not need to wear a gown or gloves, but the transporter does. And if they have a wound, they must cover their wounds completely. Now, droplet precautions. So, protects against droplets larger than 5 micrograms because they travel 3 to 6 feet from the client. So, type of infections, it could be influenza, pertussis, mumps, rubella. It could be pneumonia, sepsis, pharyngitis. So what is required for these clients? Again, a private room or with another client with the same infection. Sorry. So when we go in these rooms, I must wear a mask. If there's visitors that are coming, they also must wear a mask. When I'm transporting this client, what do? I'm going to put a mask on them. Absolutely. Now, do I have to put a mask on? I can, but it's not required. But transporting the client, I must put a mask on them. Now let's talk about airborne precautions. Airborne precautions, the droplets are smaller than 5 micrograms. This could be measles, varicella, tuberculosis, herpes zoster, so the blisters. So what's required? A private room. They have to have a special respirator for the caregivers So N95. So when you go to clinical or in the future and you've never been fit tested for the N95 respirator, you can't go in that room. Now, what if they have visitors that are coming in? They can wear a plain surgical mask because they have not been fitted for this N95 respirator. The room must be a negative pressure airflow exchanges, about 6 to 12 exchanges per hour. So what does that mean, a negative pressure airflow? So this means that the air that is coming into the room, it prevents that the negative pressure, okay, let me start over. So if a patient has a negative pressure airflow, okay, they're in a negative pressure room. That means the air that is in there, it is prevented from flowing out of the room and going into other rooms because those particles are less than 5 micrograms and they can travel. So again, remember when we talked about patients who have TB, their stages of infection might not be for months to years. So for those months to a year, they're infecting so many people. Okay, and now those people, their defenses are up. You may not even know that you are just talking to someone who had TB. Okay, now when I'm transporting a patient, I need to put a surgical mask on them. They don't get an N95 respirator to wear because again, it's fit tested. They have to do all these specific motions while wearing the mask, and they're not going to do that for clients. So now let's talk about protective precautions. So this is also known as neutropenic. This protects clients who are immunocompromised. So allogenic hematopoietic stem cell transplant patients, those who are receiving chemotherapy, or patients who are transplant patients. So what is required for them? A private room, positive airflow, a HEPA filtration for the incoming air. Now, what is positive airflow? So the air will flow out of the room instead of in. So any airborne microorganisms do not enter into that patient's room and infect them. Now, if I'm transporting this patient to CT, I'm going to put a mask on them, just a normal surgical mask. Now, these patients can't have any flowers. Why can't they have any flowers or any fresh fruit? Because these flowers and the fresh fruit, they can actually harbor some fungi, which can be detrimental for these clients. All right, so the client has a draining abdominal wound that has become infected. In caring for the client, the nurse will implement which precautions? Contact precautions, droplet, no precautions, or airborne precautions? What do you think? Contact. It's going to be contact precautions, by the way. All right, I'm going to let you read through this. So why is infection control so important? Main thing, to prevent the spread of infection. Hospital-acquired infections. These infections are acquired while receiving care in a healthcare setting. 1 in 25 patients get a hospital-acquired infection. So 648,000 patients in acute care hospitals developed hospital-acquired infections, and about 75,000 patients died because of those hospital-acquired infections. That's a large number. Just imagine if you were one of those patients. Imagine if that was your loved one. How can you prevent that? How can you prevent from them passing away because of a hospital-acquired infection? I'm not to try to sound so gloomy, but it's true. Now, longer stays, it means more treatments, more tests, more antibiotics, more normal flora that's getting destroyed. It takes a long time for these clients to build up their defense system all over again. So the most common hospital-acquired infections. When I think of a hospital-acquired infection, I think of, okay, what happened and why did it happen? So let's talk about IVs, intravenous catheters. We use them a lot, all the time, because it helps us give medications, fluids through the veins. Same thing with central lines. bloodborne infections or bloodstream infections. So they go straight to the bloodstream and they could get septic, bacteremia, Clostridium difficile infection. So if a patient has a lot of antibiotics, they can get seeded from this. It's the most common thing after antibiotics. Pneumonia, surgical patients, post-surgical patients, elderly clients, patients who are just laying in bed, not doing deep breathing or good cough exercises can develop pneumonia. MRSA infections, surgical site infections, urinary tract infections, especially when they get Foley catheters when they do not need them. So catheter-associated urinary tract infections are one of the most common hospital-acquired infections. So you'll hear CAUTI a lot. It's a big thing nowadays. Prolonged use of catheters is the biggest risk factor for CAUTI. So what can nursing do to prevent CAUTIs? We're going to talk about this in class. And then we're going to watch this video. You're welcome to look at the video and look at the site before class. All right. Okay, so that is the end of this. If you have any questions, let me know.